Good morning. Thank you so much for the kind introduction. Before I start, I would like to thank Dr. Gautam Gastami and the entire team for the excellent offline conference. So far, we have been experiencing, online conference, get up in the morning, which the webinar is there, which conference is there, how long I'll have to log in. So fortunately, we are here without online. It's an offline. Many of us doesn't wear mask also after 2 years of a pandemic. The topic which I am selected today is artificial intelligence. We know that as an embryologist, we have been working for ages in an embryology lab in order to perform the best job inside the embryology lab and get a good quality embryo, which is very essential for better IVF outcomes. So this is what is expected in the IVF lab. This is what is expected by the clinician actually. So that is where the embryologists are putting their effort to create a better quality embryos and a competent embryos, so that he will be able to tell his clinician that this embryo, if we can select, definitely it is going to be having a better outcome. But there's so many gadgets have been adding into the embryology lab, and here is one. It has come as an artificial intelligence. This is nothing like what we do is an IVF with in vitro. So intelligence, other than the brain, the equipments are taught to do the things. Let me define what is artificial intelligence. Start with the theory and development of a computer system able to perform a task normally requiring a human intelligence, such as visual perception, speech recognition, decision making, and translation between the languages. So another way, if you want to define, artificial intelligence is an intelligence demonstrated by the machine as a opposed to the natural intelligence displayed by the animal, including the human. So where and all one can utilize this artificial intelligence? That's in the healthcare, robot-assisted surgery, virtual nursing assistance, administrative workflow assistance, fraud detection, error reduction, clinical trial assistance, and AI is very extensively nowadays used in assisting the diagnosis. But I am going to speak and restrict myself on the embryological thing which is happening in the embryology lab. So in order to get a good quality of embryo, the quality control maintenance in the IVF lab is very important. That would be the reason why we always be cautious whenever we select the equipment, and we keep checking the equipment performance. There are so many ways by which we will be able to cross-check it, and in order to maintain the quality control, it is must that you will have to lay down whatever the procedure we do it in an embryology lab in the orderly. You are not following the protocol strictly, not deviating it. So definitely the shortcut deviating might have a problem as far as getting a good quality of the embryo is concerned. That would be the reason why in an IVF lab, quality control, quality assurance manual has to be there, and who are performing in the IVF lab, they should be doing and following the strict. Because when you have multiple cases, good number of cases, and it is not possible to do each and everything with the individual actually. That is where actually who are doing the procedure in the embryology lab, they strictly follow so that there is no variation. Generally, it is thought that the many people are there, the variation get come in. By following strictly SOPs, it is definitely you will be able to get a better quality. But these are all the things which is independently done, and it is being entered in the computer. But how you are going to correlate with artificial intelligence? This is a very important, because now there are certain things we use it in our lab actually. Say for example, something is connected into the incubator, the CO2 level goes down, the fluctuation is there, you get an alarm. Okay, so these are the small things which we get. But in order to get, if you are applying this particular AI into this particular the system, and you will be able to get and the information, and the machine learning will be there, so that it will be able to give the right information the right time. So So that's what, whenever we do it, we will be able to, we're supposed to do it, properly. There are the, interperson, intra-operator variation is there. In order to overcome all these things, if you have an artificial intelligence, definitely we will be able to sort out the problem as and when it is appeared. And using this also, it is not like that you just keep checking the equipment performance, embryo quality, all those things, even the staff-related quality assurance and the quality control, also it can be done actually, documenting the competency of the IVF lab staff. So this is what, whenever we are doing it, the documentation is very important. There is one accredited company is done a documentation done in various labs. They have come to know that not many of IVF labs are not documenting. Documentation is very important. When you have a documentation, this documentation has to be taught into the machine. Machine will be able to visualize it, and it will be able to give you the result. So that's how in future actually the lab director who is doing all these things actually, he is enter into the Google era now. Actually, we will be able to have an op which is, explains about staff quality control and assurance, instrumentation, the documentation control, alarming, education. These are all op which is there in one dashboard actually. Lab director will be able to work it on this thing actually and see how the things are going in the embryology lab using this artificial intelligence. So we have been digitalized. India is being digitalized. Definitely our lab is also digitalized, is happening actually, but how efficiently we are doing is very important. And when you do like this, the digitalization and link into the artificial intelligence, you will be able to get to a flag, kind of a red flag kind of a thing. If something goes wrong, actually, you will be able to get into, because many a times there are some the flags which rise there actually, which is a critical. You will have to attend that particular problem immediately, which is very important, and taking the exact form. So we always see it and write it in the form actually. So in artificial intelligence, what we can do, what one can do it actually, we can write it and feed it actually, the machine able to visualize it and recognize it. And these are the things actually, whenever we are doing the step by step, if you if you stop the step, if you did not do the one step actually, it will identify the error actually. Hey, you have not done this particular step, go back. Or as witnessing, all these things interrelated. As a result, you will be able to identify, because many a times mismatching takes place actually, double witnessing, and the AI into this thing actually, I think we will be able to control all those things. This is one very recently, discussed in the one abstract actually, deep learning early warning system embryology, because the person who is doing a job in embryology, it is very important, and is competent, is decided what quality of the embryo is going to provide. If I want to provide a good quality of the, I have maintained all the quality control in the IVF lab, which is all interlinked. So with this AI, one can be able to identify all these things. Early embryo developmental stage markers as a prediction for the embryo culture environment. That's why whenever you are culturing the environment, you will have to make sure that there are 4 parameters, pH, temperature, CO2, and lab environment. These are all the things to be controlled. So this, whether you are as an embryologist maintaining or not, this can be assessed by the AI system, which is interlinked to so many gadgets which is there in the embryology lab. Ideally, all this remote monitoring will be performed through the laboratory information monitoring system. So because as a lab director, actually, these are all the things which are there, and whatever is happening in the laboratory, we should be monitoring it. It may not be physically. There is artificial intelligence which is performing by the machine learning process. Now move on to the specific use of this artificial intelligence for assessing the gamete. So whenever we perform the IVF procedure, we look into the oocyte, we assess the oocyte quality, looking into oocyte cumulus complex. If you have to have a pre-ovulatory oocyte, you have to have a well-burst corona radiate, good granulose cells, which is a pre-ovulatory. That is what a somatic assessment you do it. but when you denote it, and you will be able to look into the nuclear maturity. But what about the cytoplasmic maturity? So when you want to assess the cytoplasmic maturity, there must be some sort of a scope to take a picture of the cytoplasm, how the cytoplasm looks within the cytoplasm, what are the things, and with the help of the microscope, and you obtain all these images, or these images are to be fed into the machine. Machine will be able to identify, yes, if you can take this particular oocyte, if you perform the ICSI procedure, you will be able to get a better fertilization, better embryo also. And all these things can be assessed by, even whenever we perform the ICSI procedure, we know that we'll have to place this polar body in 12 o'clock or 6 o'clock. And even when you are performing the ICSI procedure, how this specific oocyte behaves, which is very important. So all this can be recorded. You have to generate the image out of all this procedure, and this has been fed into the machine, taught into the machine. Then this machine will be able to tell you definitely this particular oocyte is going to go into good embryogenesis or good blastocyst stage as well. And we all know that we have been using the CASA. Very slightly, there are sort of an AI included into that, where we will be able to assess sperm morphology, motility, DNA integrity to select, in order to select a better sperm. But what happens when you want to extract the sperm from the testis? So this there is a limitation whenever we are performing the CASA actually. Say for example, motility is not good, count is not good, cellular debris is also read by CASA, and it will give a more count, though it is oligoasthenospermic. But in order to identify the sperm which has got a good morphology, when you extract the testicular tissue, we need to take a massive number of the picture. This has to be taught into the machine. Then you will be able to select the spermatozoa using a AI, which can give you better fertilization. Because we say that if you have a testicular the spermatozoa compared to the spermatozoa which you find it in the normal ejaculation, fertilization rate may not be up to the mark, even though fertilization rate is good. The quality of the embryo is compromised. But using AI, I think even through the testicular tissue also, you will be able to select a better quality spermatozoa, which gives a better quality embryo. Coming to embryo evaluation and selection, that is categorized into 3 steps. Automatic annotation of embryo development, that is a cell stage and a cell cycle to be assessed whenever you are selecting the embryo for the transfer. Embryo grading, mostly in the blastocyst, because early embryonic stage, when you do it actually, you might not get a better outcome. So that's why they prefer to do this AI-linked assessment at blastocyst stage. Embryo selection for implantation, because we always depend on the grade of the embryo, good quality embryo, you transfer it, and one step ahead, you will be able to select the embryo using AI, which can give you better implantation. Coming to automatic annotations, we know this is nothing but we observed the embryo developing in vitro by time-lapse video monitoring, and this is a technology is there for last 10 to 15 years, trying to make a common algorithm. So now many companies have come up with a better algorithm and better annotation also. But whenever we perform all these things, a different company, different individual is doing it, variability is going to be more. This is one problem we always face as far as giving a better result. When you overcome this variability using the AI, actually there is always a accuracy in doing the things, and it is reproducible and specific, and they should recognize the abnormal cellular development, which is very important. So that is what we have been using a time-lapse video monitoring, and we say that we send even though abnormal embryo on, to the PGS screening, but it finds a good euploidic embryo. But now this is in a technology where AI is taught obtaining more and more the images, and what we call it as a deep learning thing. So we have been guiding the embryo just looking into the day of culture, day 2, day 3, and the blastocyst. In the blastocyst stage, we generally use a Gardner in order to grade the embryo, where we will see inner cell mass under tropectoderm. And what these people have done, they have gone a step ahead actually. They have taken the images of the ICM inner cell mass and the tropectoderm, different focal length actually. They have identified and the embryo which can be successfully hatching and in order to implant. And further ahead, there is one study actually at the end of the thing actually they have assessed the zona pellucida thickness also, parallelly tropectoderm, how tropectoderms are expanded, blastocelic cavity, inner cell mass. With these segmental, focal images, they were able to get a better outcome. So that's what. So then coming to the embryo selection, it is the important point whenever you are doing the embryo transfer, which embryo you have to select it. Okay. Again, here variability is there. Using a AI, I think we will be able to select a better quality embryos. Some groups are emerging. AI companies focusing on applying embryo assessment to predict the likelihood of live birth also, because they went ahead actually. So assessing this particular thing in the history of this particular patient and the time of registered till the embryo transfer, and considering the things which they have collected from the embryology embryo transfer, they will be able to predict the likelihood of live birth also. To conclude, application of AI in embryology have gained most attention and shown a great promise. Artificial intelligence driven approach are likely to be more objective, more rapid, and most importantly assessing patient characteristics such as ovarian reserve, age, endocrine status, clinical diagnostic tests will undoubtedly increase the efficiency of diagnosis and treatment of all reproductive disorders. Thank you very much.